Good evening, ladies and gentlemen. Hope you are doing well. Hope you are fine. My name is Kambi John Bosco, and I will be taking you in environmental and occupational health. This is a health science course or a public health science course, and we need to understand it very well in order at least to have those particular skills in workplaces and even where we reside. In today's lesson, we are going to understand the meaning of environment and occupational health, and then you, as a public health worker, you will apply the knowledge in the field where you will be working. For those who are working, still you can apply the knowledge acquired in those particular fields where you work. Environmental and occupational health includes the broad and diverse suite of interrelated regulatory and educational programs and services needed in every community to prevent, to identify, to mitigate illness and injuries resulting from hazards in the natural, built, and work environment. So when you look at this introduction of ours, there are some key elements that we have focused on, including preventing, identifying, and mitigating illness. Why should we learn environment and occupational health? Because it will help you in identifying, preventing, mitigating injuries as well as illness from those hazards that may be created naturally or even that do exist in the work environment. Occupational health and safety. Here we are saying that is one of the most important aspects of human concern. Why? Because its aim is to have or to make an adaptation of working environment to workers. This one, it is just for the purpose of promoting and maintaining the highest degree of physical, of mental and social well-being of those workers. Okay, so when this one is applied or when it is practiced in the work environment, workers or employees will work well, will have the highest degree of physical, mental, and social well-being. They will work with special health. I will call it special health because their health will be accompanied by some kind of treatment that will always be available depending on the safety mechanism that has been applied or that is applied within that particular organization. The benefits of occupational health, mainly in developing countries, including Somalia, is seen locally as well as on national level. Why? Because it has a positive impact. It has a positive impact, especially in reducing mobility and work-related injuries. Okay? That positive impact makes it something that is very, very important within organizations. And that's why we may always be recommending organizations to practice these occupational health mechanisms within their organizations, and to put it as one of the key requirements in doing daily plans of the organizations. In addition, here we are saying fewer losses to employer and worker, as there will be reduction of wage losses and decreased compensation costs. Why? If this mechanism is not applied within the organization, yeah, always or every time you will be in compensating the workers because of their loss, because of the injuries. There will be increased work turnover or employee turnover. The absenteeism will increase just because of this. Because if an employee gets injury at the workplace, tomorrow he may not be in position to come and work. Someone is sick, he or she is injured, he cannot have any ways of working for that particular organization. So with this, the implementation of this mechanism, all those kinds of issues will be solved at a time. Here we can only say that environmental and occupational health practices, they require what we call a close collaboration with environmental and public health systems. We relate it to public health because this is a public health concern. It's a public health concern. That's why you will find that majority or most of the time we shall be talking about public health in this unit because it's a public health concern. The environmental and occupational health activities, they include but not limited to identifying, evaluating and controlling chemical, radiological, as well as biological hazards, and these ones we shall look at them one by one and we see how we shall handle or we shall gain knowledge out of them. Then it also aims at assuring a safe and healthy food supply that considers the farm to fork concept. When I say farm to fork concept, is like in the farm you get some kind of products or consumable products, but when I say to fork, it's like when they reach home, we believe that those kind of products are healthy. So how should you keep them and protect them or make them to be healthy products? It's just by implementing the environmental and occupational health activities. Then there is also assuring basic sanitation and safety in hotels, in pools, in compounds, and other public places and workplaces. That is also a concern of environmental and occupational health activity. Then monitoring the safety use and the handling of radioactive materials in healthcare and industries. Other concerns, you see them, like ensuring that workers are adequately protected from the range of physical, chemical, biological, and psychosocial hazards associated with the work. Then preparing for and responding to natural and man-made disasters, including those potentially exacerbated by global climatic change. And those ones you will have to look at them. We shall look at man-made disasters. And for those who have already covered disaster management, I think you have looked at that. But I believe you have not looked at that, all of you. But in disaster management, we shall look at them. Then there is also conducting surveillance of occupational and environmental hazards and relevant health outcomes to provide evidence needed to take action in local, regional, and statewide communities. So you look at these ones as some kind of protective mechanisms. So as a social worker, as a health worker, public health worker, you have to consider these as key elements, and as environmental and occupational health services should be practiced in order to have all these ones accomplished. How do you define it? How do you define occupational safety and health? we shall take definitions according to World Health Organization, whereby for them they look at protection and promotion of health of workers. They look at also enhancing the physical, mental, and social well-beings of workers, as well as development and promotion of sustainable work environment and work organizations. And then when you consider all these ones, all these definitions, we shall look at, or we shall see that there are many kinds of factors we have been talking about earlier before. For example, elimination of occupational factors and conditions, especially in hazardous environment. Then we have also looked at physical and mental, together with the social well-being of the workers. We have talked about that, as well as looking at the sustainable work environment, all environment that can be conducive to every employee who is within that particular organization. Still, occupational health and safety cover the following components. Here we have mentioned before, but you may find that maybe some books you will read, you'll find most of them have been like elaborated, and maybe you may find that they are talking about more than 4 disciplines. In our discussion here, we are talking about the availability of occupational health and safety regulations at the workplace. Then we talk about the availability of active and functional occupational health and safety committee at the workplace. Then another one, monitoring and control of factory hazards to the health, as well as supervision and monitoring of hygiene and sanitation, especially those sanitary facilities like the toilets, like the shower places, and so on and so forth. Those ones, monitoring and supervision of those particular areas or places will ensure that the organization have safety healthy mechanisms. Still, there are others here like inspection of health services, then pre-employment, then performance of adoption of worker to man, then provision of first aid, health education and safety trainings, advice to employers on the above mentioned items, as well as reporting of occupational deaths, diseases, injuries, disabilities, hazards, and their related preventive measures. So try to go further and research about those kind of disciplines. There are some common problems that may be encountered in the development of occupational and health service or services, and these ones, they include but not limited to: 1, lack of awareness among workers, employees, or employers, health planners, policy makers, health professionals, and the public at large. Secondly, limited training in the human resource or limited trained human resource. Then inadequate, inaccessible, and inequitably distributed health service institutions. You may find that maybe in this particular area or the available health service institution is lower than providing the services required by that particular community. Then lack of multidisciplinary staff, absence of field testing equipment for conducting environmental and biological monitoring of the workplaces and the health of the workers. Then insufficient budget to carry out regular inspections or even conducting research activities about these health services or the occupational health services. Then there is also the characteristics of the workers. The majorities are poor, they are illiterate or poorly educated. Those are now the workers in an organization. Even if you tell them to do something, they may see as if you are against them. They may not bear with following the rules and regulations governing that particular organization. Other problems, we have poor working environment, no specific regulations, unfavorable climate conditions, and the heavy load of endemic diseases, pandemic and endemic diseases, including bilharzia, coarctiasis, malaria, and trypanosomiasis. Those kind of diseases, if they are in existence, or if there is no pre-identified public health and occupational safety mechanisms, these diseases may spread at a great rate. Then we have also absence of training institutions on occupational health and safety. The available training institutions may not give clear knowledge on occupational health and safety. Then there is also little or no collaboration or cooperation among the stakeholders. When we talk about stakeholders, we are not talking about only the health workers, but we talk about also the organizations that do support communities. We talk about government. We talk about citizens within those particular communities. We talk about also those other countries, neighboring countries. If you don't have collaboration, for example, there was a certain incident which happened along Kenya-Uganda borders, whereby locusts invaded that place. And when they came to that place, the two governments, they collaborated and fought against those particular insects. We call them locusts. Some of people, they say that there are some communities that do eat those locusts, but I don't think that they are eatable. I only see grasshoppers. Maybe some of you guys, you don't differentiate between locusts and grasshoppers. So if there is a collaboration or cooperation, or if there are clear international relations, then among those particular communities or societies, then most of those problems can be covered. Then poor information exchange, lack of multidisciplinary forum, then absence of integration of occupational health and safety with the general health services, because there are some countries, they don't consider this one to be a health concern. I believe this has been a short and summarized lecture, and hope you have enjoyed it, and I believe it will benefit you while planning to do your final examinations. Remember to revise and to continue practicing. Look at all the books we sent you, look at the materials, try to summarize them the way we always do. Summarize them and revise accordingly so that you do your final examinations effectively. My name is John Bosco. I wish you a happy life.